In your opinion, what are the most significant ways for promoting comprehensive heart health in Europe?
At political level, I think that it's time to establish the health promotion and the cardiovascular prevention as a real priorities. At healthcare, I think that not only in cardiologists but in all the professionals, it's important to improve the risk stratification and to improve lifestyle because, as you know, the great majority of the atherosclerotic events could be preventable if changed the risk factors. And the second point that I think that's important at level of the healthcare to simplify and to standardize the guidelines. At populational level, I think that it's time to increase the literacy, the awareness about not only the cardiovascular disease but the measures to prevent the cardiovascular disease.
How can a physician contribute to addressing barriers and challenges associated with holistic heart health in Europe?
I think that the physician is only one of the players of these multidisciplinary teams that is needed to improve the cardiovascular health. Of course, I think that physician has an important role. For example, in our daily practice, it's important to detect and to identify the major concerns of the patients because sometimes these concerns are different from the endpoints that we use in our daily practice. Of course, it's also important for an accurate risk stratification, for early detection of risk factors, and also to implement and to evaluate the implementation of measures, both in primary and secondary prevention. I think that physician has also a central role, for example, information of healthcare and other professionals, because with this standardization of practice, it's possible to improve this overall need that is the decrease of the cardiovascular burden of the cardiovascular disease.
Can you share your perspective on the latest innovations in cardiovascular care when it comes to prevention and risk management and their potential impact?
Yes, I think that the last years have been marked by several innovations and advances in cardiovascular care. For example, we now have a new risk certification scores, like for example the score 2, that improve the certification of our patients. We have also a new risk factors and also risk modifiers beyond the traditional cardiovascular risk factors. For example, environmental issues, especially air pollution, socioeconomic determinants, psychological characteristics, so factors that are sometimes forgotten but are very important. Also, very important, there is growing the interest and the application in clinical practice of digital-based solutions, both to help not only the physicians but also the patients. So I think that joining these innovations with the strategic options of our politicians, I think that we can improve the cardiovascular health in the near future.